Hi everyone, this is Shalu Kumar again from OSCE Nurse Training, Cambridge. I'm an experienced OSCE Nurse trainer for the NMC OSCE exam in UK. I'm also a NMC registered nurse with a lot of bedside clinical experience and also experience in supporting and educating overseas nurses and undergraduate nurses. I'm back with another NMC OSCE video for your revision. So let's have a look. So we will look in the video in a minute. So if you do like my videos, please press the like button and subscribe. Keep those comments coming. They do really help me to guide in a way what do you want to see next. Okay, and I do keep those comments coming. It's really helpful to see those comments that they are really helping you to pass your exam and helping you in your revision. So just keep them coming. Do ask me a question, but I do try to answer as many as I possibly can. Okay, so today's video we're going to look at a simple mistake which can actually fail you in implementation station. So we're going to talk about NMC OSCE implementation station, which is your drug administration station. Now, lots of nurses recently are failing on dispensing drugs. So you may be doing everything else right in your exam, but if you do not dispense it as per guidance from the Royal Pharmaceutical Society, which gives you guidance how to store and dispense medications in UK. So if you do not follow those guidance and you do something different, which you may be used to doing back home, then it can be a critical fail. And we have heard lots of nurses have been actually failing on this particular aspect of implementation station, where they come to dispense the drugs. Either they're dispensing it wrongly, or they're using wrong technique, or they're dispensing wrong amount of medication. So we're going to look at all that because we definitely don't want to fail on that. So we don't want to fail anyway, but we definitely, we don't want to make a simple mistake like that. Okay, so we're going to look at that today. So let's have a look. So what are the principles when you are dispensing medications in UK? What are the principles we stick to, and what do they expect you to do in exam when you're dispensing medication? So the first one on your screen is use non-touch technique. We do not touch our tablets. Okay, we do not touch our medications in UK with bare hands or even with gloved hand. You don't need to do implementation station with gloves and apron. It's not needed. Lots of nurses do ask me, no, you do not need them, but you do not touch your tablets. Okay, so apply non-touch technique. It means clean your hands before you start dispensing. You don't need to clean hands between dispensing one medication then another, no, but just in the beginning of dispensing, just clean your hand. And then, like I already mentioned, do not touch tablets. So tablets need to be dispensed direct from the bottle or the box straight into your medicine pot. Okay, so try to do that. They go straight into the medicine pot. They do not you do not touch them. Next one is make all your drug checks. Now that's obvious one, because you need to know if it's the correct drug, correct dose. Route you already checked on your prescription, but now you need to check the name of the drug, the dose, and the expiry date. So that's really important. And it's not only just checking. You may be checking with your eyes, but if you're not verbalizing that you're checking, examiner is quite far away from you, so they will not take your eyes moving on the bottle as a check. Okay, they need to clearly hear you saying the name of the drug when you pick up, the dose, the expiry. Okay, so that's really important. You verbalize very clearly, and don't just be quiet or just keep doing it in your head, but not say. That's not right. Okay, verbalize everything. Number 3, dispense correct amount of tablets. Now that's really important, because sometimes you're in exam and you assume things. Okay, there is no assumption. So the drug which is the stock dose may be different than prescribed dose in your drug chart. Okay, it's not always the same. Don't make any assumptions that if you're, say for levothyroxine, if you are gonna give 75 milligram or 100 microgram to your patient, not milligram, it's microgram. So if you're giving 100 and your stock dose is 25, to make 100 of prescribed dose, you have to give 4 tablets. Okay, so don't assume things that it would be only 25 microgram prescription. No, prescribed dose can be different to the stock dose. So it's your job to make sure what is the dose on your bottle or box, and then match it to your prescribed dose and work out how many tablets you're giving, and again verbalize it. Examiner doesn't come later on to see how many you dispense. They pass or fail you on your verbalization, how many you are dispensing. Okay, and they will be very clearly listening to, they will be very carefully listening to you, that you are comparing the stock dose with the prescribed. The stock dose means what is given to you in your drug trolley or tray or bottle, whatever it is. Okay, so whatever is on the bottle or box to your prescribed dose in your drug chart. So that's really important, that you verbalize clearly the number you're dispensing. Okay, so the next one we move on to dispense one kind of a drug in one pot. So when you're dispensing drugs, make sure you do not mix different drugs. Okay, so we want to dispense one drug in one pot, one kind of drug. So if you're putting 2 paracetamol, they can go in the same box, and then they can go in the same medicine pot. And then if you next drug is furosemide, then you got to dispense that into a different medicine pot. So that was about the dispensing different drugs in different medicine pots, and not mixing them. So the last one is, if you dispense extra by mistake into your medicine pot, so instead of taking 2 paracetamol, I take 3. So what do I do about it? Do I put it back in the box or bottle? No, you're not supposed to put it back in bottle or box. You need to just transfer one into another medicine pot, the extra one, and then just say, I'm discarding this in safely into a sharp bin. In some, on the wards clinically, we do have where we dispense our medicines, the special bins, but in exam they give you the sharp bin. So you can just say, I am just disposing it is in there. Okay, but you're not supposed to put extra one in your box or bottle. And again, definitely do not go digging into the medicine pot with your fingers to take extra one. No, just take the other medicine pot and transfer one in that extra one or two, whatever it is. Okay, so I hope you like this video, and I hope it makes it clear what mistakes not to make when you're dispensing drug, and use a non-touch technique, which is really important, and you dispense correct drug within expiry date and the correct dose, and you do not put any extra back in the bottle, okay, or box. Keep watching my channel. If you like my videos, do share with your other friends who are preparing for OSCE. We do full OSCE training for both adult and pediatric, so you can email us on oscenurstraining@outlook.com, visit us on oscenurstraining.com, and check our Google reviews on our Google page, and see what nurses been saying about our training. So I will soon be back with another video for you. So bye for now.